Okay, so welcome once again. So today we are going to learn about understanding vaginal health and reproductive health and the natural solutions which you can be able to use in today's life in order for us to achieve this vaginal health and the reproductive health. So my name is Sharon Charotich, for those who don't know me, background medical laboratory technologist and also health coach for Ever Living Products. Yeah, so I'm going to touch on major topics from definition to now how to naturally eradicate these infections. Okay, so it won't take much time. So just be keen and then you get to understand the basic concepts about these issues of vaginal health and the reproductive health. So let's start off. Like, what is now the definition of vaginal health? So we are talking about the overall state and well-being of a woman's vagina and the reproductive system, like how it functions, how it feels, how it protects itself from infections. It's more than just being free from diseases, yeah? It's about the comfort, the balance, and the confidence in the body. So like a healthy vagina should be having a slightly acidic pH. That is about 3.8 to 4.5. That's when it can work optimally. It can fight itself from infections. And the slightly acidic pH supports now the beneficial good bacteria. So in the body, we have the good bacteria called the lactobacilli bacteria, and slightly basically we have the good and the bad, but the bad ones are in a lower level, mostly the yeast infections. So these good bacteria, they suppress the bad bacteria. So, and it does that when only the pH is controlled, when it is having a pH of 3.8 to 4.5, yeah? So the slightly acidic pH supports the beneficial good bacteria, the lactobacilli, now preventing the overgrowth of the harmful organisms, be it bacteria, be it the fungi. So that's the basic definition of the vaginal health. And then we have now the common types of vaginal infections. So kuna kadhaa. We have the bacterial vaginosis. So this is commonly caused by overgrowth of harmful bacteria that replace now the good bacteria. So have in your mind that we have the backbone of, like, there's a good bacteria. This is basically meant to protect the body or the urinary tract system. Now, when this good bacteria goes down, meaning the harmful bacteria cause harm, that's when now there's bacterial vaginosis. Then the second type of vaginal infection, it can be yeast infections. This is commonly caused by a fungi called the Candida albicans. So meaning there's overgrowth of the fungi pathogen. That's now the yeast infection. And later on, I'm going to give the symptoms of each one. At least you can get to understand when it is BV, kuna signs kama gani. When it is yeast infection, ina present aje, yeah? Then we have the urinary tract infections, most commonly caused by a bacteria called the E. coli. And then we have the trichomoniasis, caused by now the tiny parasite called the Trichomonas vaginalis. Yeah, so it can be bacterial, it can be fungal, it can be parasital. The major ones, the common types of vaginal infections. And then now, what causes this vaginal infection? So the common causes of vaginal infection. So there are major factors, and I'm going to touch each factor and how it can contribute to recurring infections and this discomfort, yeah? So the major factors we have, number one, imbalance in vaginal pH. So as I talked earlier, that a vaginal, like a good or a healthy vagina or reproductive system, it should have a slightly acidic pH, like between 3.8 to 4.5. So when there's imbalance in this pH, it will now favor the growth of the bad bacteria, the fungi. Like mostly these fungi, they love alkaline condition. So meaning when pH goes up, the fungi will grow, yeah? So imbalance in vaginal pH is a number one or major factor which is causing vaginal infection. Then we have number two, overuse or misuse of antibiotics. Yes, antibiotic we can use, but you use antibiotics when prescribed. And the moment you are done with your dose, you should restore the lost good bacteria with a probiotic or a balanced diet in your probiotic. Because basically, antibiotics, mostly they are broad spectrum. So they kill the bad bacteria and end up flushing the lactobacilli in the vaginal area because we naturally have the lactobacilli. So when now this lactobacillus is flushed out, na tunategemea the lactobacilli to maintain the pH because the lactobacilli produce the lactic acid. So they should now produce lactic acid to make the vaginal area to be at a slightly acidic pH of 3.8 to 4.5. So when you overuse the antibiotics, when you misuse antibiotics, meaning the good bacteria will become less, or they'll become flushed out. So that is number 2. Then number 3, we have hormonal imbalance. So hormonal imbalance can come as a result of maybe during menopause, during pregnancy, or during when you use a lot of contraceptives, or also during luteal phases, like when you're almost getting your periods. You get some people telling you that they even get so much itchiness, discharge, back pain, some few days before their periods or some few days after their periods. So tunategemea like the hormones when they are okay, especially the estrogen. So when the estrogen hormone is in the right state, it's like now maintain the vaginal area to be okay. By 1, it's supposed to drive the breakdown of the glycogen to glucose. So remember the lactobacilli we talked earlier, inategemea the glucose kama chakula yao. So whenever there's no enough food, meaning it will starve and they will reduce in number. And tunategemea the estrogen to do what? To break down the food for this lactobacillus. So meaning hormonal imbalance can also greatly affect the level of the lactobacillus. The lactobacillus tuchukue tu kama soldiers in the vaginal area, like their bodyguards in that place, yeah? Also, the hormones are supposed to produce antibodies to fight back, especially the Ig antibodies. So meaning an imbalance will render the body to be in a state it cannot even do its work properly. That's why it's also a common cause of vaginal infection. Then we have number 4, poor hygiene practices. So poor hygiene can be maybe due to like wearing tight clothes. So when you wear tight underwears, of course, utakuwa una attract moisture. So this moisture like inakuwa kama breeding place for the bad bacteria and the yeast infections. Also, during menstruation period, if you use your pads or panty liners for a long time without changing, like you don't change frequently, it can attract also the growth of the bacteria and the fungi. And also maybe you are dodging sana, you are using vaginal sprays, you're using scented soaps, it distracts the vaginal flora. So those practices also can affect the way the system is also supposed to be working. Then we have number 5 here. So number 5 is a weak immune system. So basically, we depend on our body to fight back. So whenever the immune system is low, it's down. And this can come as a result of poor diet, mostly poor diet or stress at times, which can lower the immunity. So whenever the body cannot fight back, meaning it is vulnerable to infection, it can get infection anytime or any minute and cannot fight back. And also this starts with the digestive system. Like for example, tunategemea like 70 to 80% of immune cells from the gut. So if the gut is also in a poor state, like constant bloating, gassy stomach, hyperacidity, it affects this immune, like production of the immune cells. So basically also, it's also address like the gut system in your body as well. Then we have uncontrolled blood sugar levels. So uncontrolled blood sugar levels, maybe for somebody who is diabetic. So whenever the sugar levels are high in the body, of course, itakuwa ina present itself in the urine. That's why you can do a urine test, unapata kuna glucose in the urine. So this glucose is feeding the yeast infections. So meaning the yeast infection will overgrow. And also high sugar levels, they also affect the vaginal flora, the lactobacilli, and they can even affect the immunity. So you can see these things, like they are almost a chain of things. Hii ikiharibika kidogo, inasumbua hii ingine kidogo. Yeah. Then you have number 7, reinfection from a partner. So this is so important. Like if you are having a partner who is having infection, and then you treat yourself, you both are having infection, you treat yourself, and the partner is not getting treated, you also get the reinfection from the partner during an intimacy. Then number 8, we have stress. I talked about this one earlier, stress and lack of enough sleep. So kama kuna stress, kuna this hormone called cortisol, which is produced during stress moment. This hormone, it affects the immune system kabisa, and it can even affect the vaginal flora. So as you can see, it's like a chain of things. When this one is not in a good state, it affects this one also. So those are the major or the common causes of vaginal infections. And then now, symptoms or signs and symptoms of vaginal infection. I just mentioned earlier on, like the common vaginal infection. So at least you get to know now, kama ni BV ina present aje, kama ni trichomonas is ina present aje. So kuna signs and symptoms somebody could be experiencing, experience kitambo, ama you could even be experiencing currently. Yeah. So we have, sorry. Poleni, somebody was trying to call. So we have this thin grayish and white discharge with mild itching or burning sensation. So mostly yoni bacterial vaginosis, which was due to what? Like overgrowth of the bad bacteria when the lactobacillus goes down. And then we have thick white cottage cheese-like discharge with intense itching, burning sensation, kuna redness, soreness around the vulva, and pain during sex or urination. So mostly this one is the yeast infections, and mostly it comes with a bad smell, which is somehow fishy-like smell. Then we could be having yellow to green, frothy discharge with a bad smell, itchy, burning sensation, pain during urination, or lower abdominal pains or back pain. So inaletwanga na ile trichomoniasis, like the D. vaginalis. This one is caused by the parasite. And then it could be burning sensation during urination, like ile kuchomwa na mkojo kabisa, frequent urge to urinate, despite the fact that you can feel the urge to urinate, but when you go to urinate, it's just small amount of urine or drops of urine coming out. Also, it can present with cloudy urine with strong smell or smelly urine. So mostly this is a UTI, the urinary tract infection caused by the bacteria. So those are the common signs and symptoms which most people experience. And yeah, most people experience that. So importance of balanced pH and immunity. I talked about this, like whenever, like this is a chain of things. Whenever the hormones are not okay, it will affect what? The glucose level. The glucose level, when it goes down, meaning the lactobacilli will starve. And tunategemea lactobacilli to produce what? The lactic acid to make the pH to be okay. Now, why is it important? So a balanced vaginal pH and strong immunity work hand in hand, also with the hormonal balancing state whenever the hormones are balanced. So when the pH becomes alkaline, as I said earlier, like above 4.5, because the vaginal health should be at least 3.8 to 4.5, meaning the harmful microorganisms, the bacteria, the yeast would overgrow, or they can even multiply easily. Likewise, immunity. When immunity is low, the body cannot fight back. The body's defense mechanisms are lower. So meaning the body is vulnerable to infection. It allows infection to reoccur or even to get infected for the first time. So this is why some women experience. That's why now somebody can say, I got infection maybe last month. I got treated maybe the same month, but the next month or the next week, the same infection came, but more severe. No. So unapatanga, yes, you got the medication, but you never got a chance to restore the lost good bacteria. So meaning the system remained empty, allowing the overgrowth of the bad bacteria and the yeast infection sana. Or during your period, your menstruation period, the hormones slightly goes down, and even the blood. You remember, you are now menstruating, the blood. Blood is alkaline in nature. So napata sasa kama ni alkaline, if you are having less lactobacilli. So this happens to people, maybe they're having less lactobacilli. So meaning the less lactobacilli gets eradicated, and then now you remain with few or less, like few lactobacilli, less pH will be in that area, meaning the bad ones will overgrow. Also, what happens at times also during intimacy, remember the semen is alkaline also. That's why some people, they can feel like they're having pain or itchiness hours after or days after intimacy. So the semen is alkaline. So if your lactobacillus is less, meaning the hiyo kidogo yenye iko pale ndani inakuwa eradicated. That's why it's so good to like learn how to get things which are going to help you naturally, or which we are going to talk about that at the end of this slide. That's it. That's why also it's good during, let me just mention, just after sex, just make sure you urinate immediately to remove those semen which are so alkaline in nature. So that's it about the importance. And then dangers of ignoring infections. Remember, at the end of the day, anything which is not addressed, iko na consequences zake, yeah? So there are some factors or some dangers. So the first danger nimeweka hapa ni pelvic inflammatory disease. This is what you call the PID. So either severe or mild infections, if not treated, if not addressed, it can cause PID. That is the pelvic inflammatory disease. Like for example, which can now lead to the infertility, the point number 2, infertility or difficulty in conceiving. So whenever the fallopian tube is inflamed, it is kuna scarration first of all, meaning the bacteria will move from the vagina, vulva, cervix, huko ndani to the fallopian tube, inako scarration, inaanza kufura. So it can cause the blockage, meaning kutakuwa na shida na the ovum moving from the ovary to meet with the sperm. And also, this one can affect, like scarration in the urinary tract or in the reproductive organ, it can affect the motility of the sperm, okay? So meaning it can even affect either the ovum moving or the sperm moving. And then point number 3, pregnancy complications. So when you're having infections and you get pregnant, kuna high chances of getting miscarriages or preterm birth, or even infecting the baby with those infections also. Yeah. Then kuna chronic discomfort and poor quality of life. Like for sure. If you're having constant itchiness, back pain, those abdominal pains, you're not that comfortable. You're not even free with people. Bad smell. You're not even having that confidence moving around with people. And then kuna increased risk of other infections. For example, if you are having itchiness, you start scratching that area. Kuna soreness itatokelezea pale chini. So those soreness, it's like open wounds for other infection to come in. Yeah. So those are the major dangers of ignoring infection. That's why it's good to address, be it severe or be it mild infections. Then our benefits of having good, so the opposite of this one. So benefits of having good vaginal health or reproductive health. So there are some points I've highlighted here. So the first benefit is enhanced fertility and reproductive function. So there's a link between good vaginal health and the reproductive system. For example, if your vaginal area is okay, your urinary tract is okay, you are not having the chance of getting PID. So you can conceive easily, your fertility rate is okay, the sperm are moving effectively, the mucus secretion is okay, because we also depend on the mucus secretion in the cervix to propel the movement of the sperm. Yeah. Also, kuna protection from infections, because whenever the body or the vaginal health is in the right state in terms of the pH, in terms of the lactobacilli, it can fight. The immunity is okay, it can fight. So you are protecting yourself or the body from other infections. Then we have the boosted confidence and self-esteem. Like if you are not having those itchiness, bad smell, back pain, the confidence is so high. Like you can imagine, as I said earlier, being in a group of people and you're smelling like a fish. Those false smell, you don't feel that comfortable with people. But now when you are having that good vaginal health, you can even control, you are in control of everything in your body, you're feeling lighter, you are feeling happier. And then balanced hormones and regular periods. Of course, if the vaginal area or the reproductive system is okay, kuna hautakuwa na shida za painful cramping, you just get your menses every month effectively, you can time your days and you can time your moment you want to conceive effectively. And then kuna reduce dependence on medication. That is true. Like if you are having good vaginal health, you are healthy. So meaning you don't depend on medication, because I know people are tired. People are tired of depending antibiotics every month or every week. So you can just, like, you're just free from medications. And then you also be free from resistance, because the moment you use a lot of antibiotics, you can even build resistance. Like the bacteria or the fungi, they start changing in the way they form their cell membranes, their DNA synthesis, their protein synthesis. They can form biofilms, whereby you can take medication very well. But after finishing, the same thing is happening the next week. You're wondering, I've taken medication very well, nimefuatilia dose vizuri, but nothing is happening. So such things can happen, like they change their shape, the cell membrane, then ni kama zinachificha pale ndani. Yeah. So that's it about the those dangers or the benefits. Yeah. Then our lifestyle factors that affect vaginal health. So I had mentioned this earlier, just quick to rush through it quickly. So lifestyle ni kama like cleanness and dryness of the vaginal health. So if you're the kind of a person who is using scented soaps, vaginal sprays, or you are dodging, you are highly likely to disturb the vaginal flora. And then tight underwears, you don't have to put on tight underwears because you'll be attracting moisture in that area, which is like a breeding place for the bad bacteria. Stress also, it affects the inaletanga the cortisol, which affect the flora and even the immune system. Poor dietary habits. Like basically we should make our food to be like medicine, not to make the medicine like food. Like you should be eating well, supplementing well, to make sure the body is getting the right tools to do its work. Poor hydration also can affect that, and poor weight management and hormonal imbalance. So also there's a link between hormonal imbalance and the weight. Whenever the weight is high, you are obese or you are beyond your BMI, it affects the hormones. Whenever hormones are affected, it affects what? The glucose. Glucose inakuwa chini, the lactobacilli will be starving. And then this lead to imbalance in the pH in the vaginal area. So with that said and elaborated and explained, now let's learn how to naturally eradicate this recurring infection the natural way. So I'm going to invite Charity Gabana to continue from there and explain to us what can we use to ensure that we are eradicating this infection the natural way without distracting the little or the good bacteria we are having in our system. So Gabana, take it up from there. Let me make you host. Mm-hmm.
All right. Thank you so much, Shaz, for that in-depth and well researched and well informed training. Yeah, it's important before we get into the solution. It's important for us to understand the problem. It's important for us to understand the history, the causes, and I believe Shaz has done a good job. Now there's the lactobacillus, all those bacteria, what causes yeast infections, bacteria infections, and what you need to look out for. So there are so many natural ways of, allow me to share my screen. There are so many natural ways of ensuring great vaginal health, all right, including, just a second. There are so many natural ways of ensuring great vaginal health, including usage of nutritional supplements, organic nutritional supplements. But first of all, I'll talk about the kawaida, the home remedies, the organic home remedies that we can use at home or in person to ensure great vaginal health. So the first one is, just a second. All right. So the first one, of course, Shaz has talked about avoiding airtight underwears. As she has said, it attracts moisture, and moisture is a breeding ground for the bacteria, which will constantly make you as a lady be uncomfortable. Down there, you're itching, and also when there is moisture and your innerwears are a bit damp, definitely there will be a bad smell coming down there. So hygiene, ladies. And nowadays, even on TikTok, I've seen a lot of people talk about soaps that you can use to wash down there. I believe the vagina can clean itself as long as you just use water that has no soap or anything that has chemicals. You can just clean it with water and it is okay. All right. You don't need to use those soaps because most of them have harsh chemicals. Sawa. The other natural way also that you can use as a lady to maintain great vaginal health is to take probiotics. Yeah, take probiotics in your diet. Like when you go to the supermarket and you buy yogurt, don't just buy any other yogurt. You can opt for probiotic yogurts, which are very, very good. But remember, at the end of the day, these yogurts have been have been stored in low temperatures, and most of them are not 100% organic. So as much as you're taking them, you're not going to depend only on them. And then also at some point Shaz has mentioned that taking high sugar diets as ladies, I know ladies, when it gets to close to our periods, that time when your periods are also almost coming, you have that craving for sugary stuff, the cakes and all that. That is also one of the contributing factors of you experiencing vaginal issues, high sugar diet. So you need to check on that as well. So checking on your diet is very, very, very vital. So your diet, your hygiene, and also checking on the antibiotics. Antibiotics, yes, they are good, but now overuse of the antibiotics, and most of them are, they are they're genetic, if I'm not wrong, and they're synthetic. So they are chemicals. So you find that you're infusing a lot of chemicals in your body, and these antibiotics now, they go and kill all the good bacteria, first of all in your digestive system, and then second of all in your vaginal area, because you need good bacteria to protect you down there, to also clean you down there as a woman. Sawa. So on top of the homemade remedies, or the personalized remedies that, or things that you can watch out to maintain great vaginal health, there are nutritional supplements that you can introduce in your diet. Ladies and gentlemen, nutritional supplements are not for sick people. Nutritional supplements are not drugs. The nutritional supplements are just like food. So they give your body what you're not getting from the kawaida diet that we are taking. You see, like for example, we've talked about probiotics, taking probiotics from your yogurt. If you've heard of kombucha, it's good with probiotics. It's good to take probiotics from the foods that we are eating right now, but you cannot 100% depend on the quality, or on the right amount of nutrients from the foods that we are eating right now, because of the growing process. There are a lot of chemicals being used right now. Most cows are producing a lot of milk, but you find it's because they've been infused with hormones. So you see, at the end of the day, we are probably maybe drinking milk, or we are taking yogurt, but we are also taking hormones that has been used to ensure that the cows are producing a lot of milk. The foods that we are eating nowadays, we are not 100% in control of the foods that we are eating nowadays. So the nutritional deficiency also is also a problem. So you cannot 100% depend on our diet right now. How we are eating right now is not how our grandparents, or the parents before our grandparents were eating. They were taking all the natural stuff, but right now we take a lot of genetically modified foods. We take a lot of the drugs and all that. So that is why incorporating supplements in your diet as a woman, there's a time I did a video of what the nutrient, I think it was vitamins, the must have supplements. Yeah, it was a must have supplements for women. So in this age and era, these are some of the must have supplements that you need as a woman to maintain great, one, reproductive health, and two, vaginal health. Because you see, when you have an issue with your vaginal health, as Shah has explained about the bacteria, the yeast infection and all that, it's also likely to affect your reproductive health as a woman. You're likely to experience conception issues, fertility issues and all that. So one of the best-selling product that we have in our company. Our company is called Forever Living Products. It's an international aloe vera company that is in the health and beauty industry. And from the word aloe vera, all the way organic, all right? A company that has operated in Kenya for over 47 years. We are headed to the 48th year right now. So this is just to give you confidence that as a lady, if you choose to use products from us, you're using high quality products that have been well researched, and every ingredient, every ingredient has been carefully selected to make sure that it suits and also takes care of you as a woman. So the first product that we have is this one, Forever Garlic and Thyme. Oh, how I love this product. It has helped me, yes, with vaginal health, and also with other also health improvements that I'll be able to share. So we talked about yeast infections. We talked about fungal infections, all right? And when you go to hospital, you'll be given maybe a drug that will help to fight the yeast infection, or an antibiotic that will help to fight the yeast infection. But you see now, this is not a natural antibiotic. It is a synthetic antibiotic. It is likely, yes, to help you sort the issue. For a day or two, you'll be okay. The next third day, you're feeling a bit itchy. It's like the problem is always recurring. The UTI is always recurring. It's because now these antibiotics, they are killing both the good and the bad bacteria, the good and the bad bacteria in your vaginal area. So this garlic and thyme, it's a natural antibacterial. All right. So what it will do, it will kill the bad bacteria. All right. It will kill the bad bacteria and fight also candida, which is responsible for causing yeast infections down there, and harmful bacteria as well. So it's antiviral, it has anti-parasital properties, it's antibacterial, and also helps to fight yeast infection. Sawa. So this is a natural antibiotic. Okay, so if you're looking for a natural antibiotic, this is the best one to go for. So maybe you're in here and you'd tell yourself, I'll go and eat basi kitungu saumu. This is kitungu saumu these guys are talking about. Tena nikule kitungu saumu. Ebu try chewing kitungu saumu right now after we are done with this call, and tell me how you will feel, and tell me how you will wake up in the morning. Your mouth will be stinking. It will not even be smelling. Your mouth will be stinking. There was a time I had a flu, and a friend of mine tricked me into chewing kitungu saumu and ginger. Oh my goodness. That was the worst taste I've ever had in my mouth. It was tasting bad. It was smelling bad. I kept belching. Unaona ile nye harufu inatoka kwa tumbo, inakuja kwa kifua, then it's like burning you and then coming out of your mouth. That was the feeling. All right. So Forever Living Products has made sure that you don't experience that. You don't go through all that as a lady because you want to maintain great vaginal health. What it has done, it has put it has put garlic in a capsule form. All right. It has put garlic in a capsule form, and not just garlic alone, but it has added thyme. Yeah, it has added thyme. Thyme is very, very good for boosting your immunity. I don't know if you guys, maybe if you pass through the spice area in the supermarket, you've seen a spice called thyme. Thyme is very, very, very good for immunity. So Forever has combined both garlic to fight the infections and thyme now to boost your immunity, so that this issue does not keep on recurring. I know, ladies, it's annoying. Every single month you're treating the same thing over and over again. You're itchy, you're not comfortable when you're sitting down. There's bad smell that is coming from there. This will really help to boost your immunity. And then it also helps with circulation, healthy blood pressure, and also detoxification. So you see, you'll be taking care of your vagina, but you'll also improving your blood circulation in your body. You'll also improving, your blood pressure. You'll also be detoxifying. Garlic is also a detoxifier. Personally, this garlic and thyme has also helped me with my chest. Yeah, there's a time I developed a serious chest issue, and I was put on medication for quite a long time, and it was not really helping. The medications actually had negative side effects. So I decided to take the garlic and thyme, and we have another one called aloe vera gel. And this garlic and thyme has really helped me come a long way when it comes to improving my chest condition. So yeah, you'll not just be taking care of your vagina, but you'll also be taking care of other sectors of your health. So the next product that we have is this one, probiotics. We've talked about antibiotics. Antibiotics, they kill bacteria. They kill, especially the synthetic, not this other one. This ours, it doesn't kill good bacteria. It kills the bad bacteria. So now you see, when you remove now the bacteria, you need to replace the area with good bacteria. So that is what probiotics do. So probiotics, they will help to restore healthy vaginal flora by introducing beneficial bacteria. The one that Sharon has talked about, which is called lactobacillus, which is very, very good for protecting your vagina and also maintaining great pH. So the probiotic will also help to, fight harmful organisms and also prevent them from overgrowing in your vaginal area, because there are certain bacteria, I think Sharon has mentioned, that are very stubborn. They stick to your vaginal wall. Yeah, that is why maybe when you're urinating, you feel a bit itchy, because the bacteria are in your vaginal wall and they've affected your vaginal wall. All right. So this one will really help to prevent the overgrowth of the bacteria. And then It will also prevent the overgrowth of candida, which causes yeast infection. All right. It also helps, it will give you added benefits as a woman. It will help with your digestive health as well. It will also help with your immunity. When your immunity is boosted, that means your likelihood of getting infections is also minimal. All right. Now, sometimes I know there are things that are out of our control. Maybe you're in a public place and you really have to use a public toilet. If your immunity is boosted, if your immunity is low, you're likely to get maybe the UTI and all that. But if your immunity is boosted and you've been exposed to an environment that can give you a UTI, your immunity can fight that infection. All right. So this probiotic is a must-have. If you're a lady and you don't have UTI, you can still use it. Why? To boost your immunity, to protect you. To build your defense so that you don't get those infections in case you're exposed to a situation or an environment that can make you get infections. Sawa. All right. So ladies, again, probiotics are good for your skin. So you'll be taking care of your vagina. You'll also be taking care of your skin as well. You'll be taking care of your immunity as well. And our probiotic has so many strains of bacteria. I know probiotics are so many in the market. And if you go and buy a probiotic from just a kawaida store, you'll be told, make sure you put it in a fridge. You put it in a fridge. Yeah, because those bacteria are very sensitive. If you just put it in whatever environment, you'll deactivate. The bacteria in those probiotics will not be useful in your body. But ours, it doesn't need refrigeration. It has been coated and packaged in such a way. It is very what is the word? It is very easy for you to carry it around. What if you're traveling and you need your probiotics, yeah, and you don't have a freezer or you don't have a fridge around you, yeah? So our company has made sure that it is portable and it is very easy for you to move around with your probiotic supplement as a woman. So the next product that we have is this one. Oh, one of my favorites as well. It's aloe. It is aloe. It has been combined with cranberries and apples. Cranberries are very, very, very good friends for your vagina as a woman. All right. The aloe helps to cleanse and detoxify your urinary tract. Remember, I mentioned there are bacteria that are very stubborn. They've stuck on the walls of your vagina or the walls of your urinary tract. So this one helps to flush those stubborn bacteria that cause a UTI, and also the candida that causes yeast infection. Sawa. So it contains cranberries plus apples, which are rich in antioxidants, and vitamin C, which make urine more acidic. All right. So when the urine is acidic and there is a bacteria that is very stubborn, or there is a yeast that is very stubborn in your vaginal area, when the urine is acidic, what does acid do? It burns, right? It corrodes, it removes. So the urine will be acidic. That means the stubborn bacteria, the stubborn yeast will be removed from the walls of your vagina and the walls of your urinary tract. I'm explaining in layman's language because I'm not a medic. I'm just explaining from experience because of personal usage and also testimonies that I have gotten from my clients. Sawa. The cranberries also, they are antioxidant. Antioxidants are they are responsible for boosting your immunity, promoting tissue healing. All right. If the bacteria had really affected your urinary tract and your vaginal wall, those tissues will heal, and also it will help to reduce irritation and inflammation. In our company, we call this drink the ladies' drink. And then it is very sweet, ladies. I know we love sweet things. It is very sweet. You can take it even as juice, by the way. You'll be taking it as juice and it will be serving you so well as a woman. So this natural support using Forever Living products is not a replacement to great diet. It's not a replacement to also great hygiene as a woman. This is just an add-on. So when you combine this with good hygiene, healthy nutrition, manage your stress levels, yeah, these supplements will help to support complete restoration of your vaginal health, prevent recurrences, and promote overall reproductive wellness. So if you're here and you don't have any vaginal issue, you need to still supplement on the products for protection. If you have a general issue and reproductive issue, you will take them and they will help to remedy those issues and, prevent now the recurrence of the issues. Yeah. So in Kenya, we say kuona ndio kuamini. So it's very important for us to also see people who've been great beneficiaries of our products. And these are some of the testimonies from a few of our clients. I was not able, because of time, I can't go through every testimony, but I just want you to see some of the women who've been able to greatly benefit from our reproductive and vaginal health product. This is a testimony I got from a client. So I followed up on her and I asked her, hey my dear, ulisema sofa garlic inakupeleka aje? She was like, iko fiti sana. And I asked her, awesome, the discomfort imepungua? She was like, yes, imepungua. All right. And after that, she took our berry nectar. All right. This is also another testimony. I asked the client if she's seeing any noticeable improvements. And she was like, yes, there is improvement. I can notice bad smell in urine is no longer. Thank you. Yeah. So if you're a lady and you're experiencing bad smell in your urine, you're experiencing maybe itchiness when you're urinating, the berry nectar is really good together with the garlic thyme and even the probiotic as well. This is also another testimony from a client. She told me this supplement is really helping. It's been 1 week of using it now and the itchiness has gone away. The bad smell is also going away. I think I will order the cranberry juice. Thank you. All right. This is also another testimony. I swear nimeenda choo nikasikia harufu tofauti ile ya mwanamke halisi, not that fishy smell, no itching, no discharge, no pain. It's working so fast. This is also another one. Now she had used our product and it was already giving her good results. Now she was even asking now, what do we have for diabetes and all that? This one tells me she's doing well. This one told me, I'm forever grateful for your help with the meds. Garlic thyme, thank you so much. I've battled these recurring infections for so long. Finally, I have a solution. God bless you. All right. So we have good products that really work. Huyu aliniambia aki nilipona, haijawai rudi, so fresh and sweet. At least you smell nice there. You smell feminine down there, right? So this one, I think she had taken berry nectar and now she was ordering for garlic. And she said, ile discharge naona imepotea, than the bad smell sahi haiko. Alafu nilikuwa naumwa na tumbo, nikiwa periods, sahi hakuna, and really happy. Oh, by the way, ladies, the berry nectar also is very good for period pain. So if you're experiencing period pains, it's because of hormonal imbalance and also, muscle contraction and all that. So the berry nectar will really help you to balance your hormones. And we also have another additional supplement that you can use. It's called Forever Nature Mane. It really helps a lot with issues to do with muscle contraction. People with extremely painful periods, it will really come in handy. So we can go on and on and share as many testimonies as we can. But do you know what we are looking for this evening? We are looking for your testimony as a woman. The next time we would like to have your screenshot here and say, this particular person bought berry nectar, garlic thyme, probiotic, and this is how they are feeling right now. Their reproductive health is okay. Maybe they were experiencing infertility. Now they have a child. We have so many allo babies. We call them allo babies. Yeah, women who've benefited from our reproductive health and fertility health products. So ladies and gentlemen, that is the end of our training this evening. As you can see, the testimonies are many, but we are waiting for your next testimony in line. So that has been our short or long training. I hope it has been impactful. You've learned something and you've seen something. You've seen a product that you can use. You've seen a product that you can recommend to somebody else, to a sister, to an auntie, to your to your wife, to your girlfriend, to just a woman in your life, to help them, because some of these issues we suffer with them in silence, because you fear being judged. How will my friends see me nikimwambia najikuna, or maybe they'll start judging me and thinking that I slept with someone and all. Sometimes tunanyamaza, tunanyamazianga hizi issue na tunateseka kama wanawake. That is why we organize this training, so that we can talk about them and we all find a solution. So this recording will be available, I think, by tomorrow. If your friend was supposed to be here and they were not there, please feel free to share with them so that they can also benefit from this information. from us to you, thank you so much for your time, and we'll see you guys on the next one. If you're a guest and you are invited here, please reach out to the person who invited you here and tell them, I want that berry nectar. Tomorrow is a holiday, we are closed, but you never know, some of us might be having stock. So tomorrow is a holiday, but just tell them you want that berry nectar, you want that garlic thyme, you want that probiotic, and it will be delivered to you as soon as our office is open. So from us to you is thank you so much for your time and have a lovely night. Also, thank you so much, Sharon, for that informative session. Well, informative session. Thank you so much again. Have a lovely night, everyone.